I'm now pleased to introduce our first speaker, Ms. Evelyn Kappeler, Director of the HHS Office of Adolescent Health. We're so honored to have her with us today to share their efforts to improve adolescent health and reduce teen pregnancy. Ms. Kappeler?
Thank you, Catherine, and good afternoon to all of you. I'm Evelyn Kappeler. I'm the Director of the Office of Adolescent Health here at the United States Department of Health and Human Services, and I'm really pleased to have this opportunity to speak with you today. What I'd like to do is talk with you a little bit about our office, a new national call to action to promote adolescent health, and our work in teen pregnancy prevention. By way of background, the Office of Adolescent Health, or OAH as we call ourselves, is located in the Office of the Assistant Secretary for Health, which is in the Office of the Secretary at HHS. And we're pleased to be celebrating our 5-year anniversary this year. The Office of Adolescent Health has a broad legislative mandate when it comes to adolescent health. We're tasked with coordinating all activities within HHS that relate to disease prevention, health promotion, prevention, health services, and health information and education with respect to the appropriate use of health care. We're unique among our sister agencies in having broad authorities to design, support, and evaluate programs, to monitor trends, and to train health providers. We also have the mandate to coordinate with similar activities in the private sector and to support projects and conduct research and disseminate information relating to preventive medicine, health promotion, and fitness. And we can also operate an information clearinghouse. But I want to caution that we do not have the funding to do all of that, but we certainly do have the vision. There are 1 billion adolescents in the world today and growing interest in addressing adolescent health and well-being worldwide. The World Health Organization issued an excellent report in 2014 called Health for the World's Adolescents, a second chance in the second decade. The report brings together all WHO guidance concerning adolescents across the full spectrum of health issues. It offers a state-of-the-art overview of 4 core areas for health sector action, including providing services, collecting and using the data needed to plan and monitor health sector interventions, developing and implementing health promoting and health protecting policies, and mobilizing and supporting other sectors. The report concludes that key actions for strengthening national responses to adolescent health. In addition, the medical journal The Lancet has partnered with 4 academic institutions to create a commission on adolescent health and well-being, whose findings will come out next year. Closer to home, I'm glad to report that American teens are generally fairly healthy. Unfortunately, some young people are sidelined by issues such as obesity, misuse of alcohol, tobacco, or other drugs, mental health problems, suicide, eating disorders, teen pregnancy, and early parenting. All of these contribute to increasing the cost of health care now and into the future. It's clear that there are many missed opportunities to promote adolescent health and to intervene promptly as problems emerge. We know that many teens and young adults tend to drift away from routine health care and consider themselves invincible. I also must note that we're aware that many of the determinants of adolescent health lie outside of the healthcare sector. Research has demonstrated the benefits of giving infants and young children a healthy start in life. And yet, with adolescents and young adults, we tend to focus on risks much more than on prevention, early intervention, and building strengths and competencies that will improve health now and into the future. So the question is, how is the Department of Health and Human Services addressing adolescent health and teen pregnancy? You're probably familiar with Healthy People 2020, which is a national set of goals for improving health. And for the first time now, it includes adolescent-specific goals, along with attention to topics such as pregnancy during the teen years. Healthy People 2020 also includes objectives for family planning, including reducing pregnancies among adolescent females and increasing the proportion of sexually active teens ages 15 to 19 who use condoms and hormonal or intrauterine contraception for both pregnancy prevention and to provide protection against disease. That's the HHS level view. Now I'd like to tell you about two key Office of Adolescent Health initiatives that promote adolescent health. The first is our new national call to action to promote adolescent health, and the second is our teen pregnancy prevention program effort to connect adolescents to services, including health care services. We in the Office of Adolescent Health are very pleased to have recently launched a new national call to action to improve teen health called Adolescent Health Think, Act, Grow, or what we call TAG. And TAG specifically aims to reach and engage a wide range of professionals who touch adolescents' lives, as well as parents and other family members and teens themselves. TAG calls upon organizations and individuals who work with teens to prioritize activities that improve adolescents' physical, social, emotional, and behavioral health. TAG is focused on supporting the achievement of the Healthy People 2020 adolescent objectives I mentioned a few minutes ago. In contrast to the traditional risk-based view of adolescent health, TAG is a comprehensive, strengths-based, and prevention-focused approach. It builds on research and focuses on the principles of positive youth development, which includes the important principles of youth engagement and building resilience so that young people can achieve their life goals. TAG is focused on raising awareness and engaging professionals, family members, organizations, and communities that share a common interest in promoting adolescent health. And the goals for TAG include raising awareness about the importance of adolescent health, engaging stakeholders, including youth-serving organizations and caring adults, getting adolescent health on the national agenda, and I think most importantly, spurring action in this area. In developing TAG, we engaged a broad group of stakeholders, over 80 individuals who represented organizations from multiple sectors with vast experience and expertise in youth services. These sectors included health care, public health, education, out-of-school time, and community-based organizations, social services, and faith-based groups. Together, we shaped the TAG framework. On our website, you can learn more about the TAG stakeholder engagement process and see a list of the organizations, experts, and federal partners that were involved in this effort. During the course of those conversations with national experts, there was universal agreement that in order to be healthy and develop well, adolescents need 5 essentials. And these 5 essentials include positive connections with supportive people, safe and secure places to live, to learn, and to play, access to high-quality, teen-friendly health care, opportunity to engage as learners, leaders, team members, and workers, and coordinated adolescent and family-centered services. I'm pleased to report that some youth-serving organizations have started to use these 5 essentials to guide their work. Using the 5 essentials as our foundation, we worked with the experts to develop specific research-based action steps tailored for the 6 different youth-serving sectors. We then developed action steps for parents, other family members, and teens as well. Some examples of the TAG action steps include having teen-friendly health care offices to providing leadership opportunities for youth. After we outlined the action steps, we then identified resources that will support the implementation of these action steps. And there are ways in which you can play a role in TAG. The TAG action steps are filled with ideas that you can use in planning, strategy development, and funding opportunities. One of our key TAG resources is the Playbook, which provides background information on America's teens, highlights the 5 essentials, and outlines the action steps and resources for each youth-serving sector, as well as parents, family members, and teens. The Playbook can be a useful tool to foster collaboration and to start or strengthen cross-sector initiatives that promote adolescent health. We also have a new TAG toolkit with social media resources, including sample tweets, Facebook and blog posts, banners for your website, sample presentation slides, and newsletter text, videos, and other digital and print materials. All of these resources are free and easy to download. You can go to the TAG landing page on the Office of Adolescent Health website, join TAG to receive email updates, download the playbook, the toolkit, banners, and other shareable resources, and you can also email us to request bulk orders of the playbook. Your plan and its providers can make a difference for young people by making their health a priority. We don't insure patients, but we do have some thoughts for your consideration aimed at making a difference for the young people for whom you provide care. Too often, we're missing opportunities to improve an adolescent's health now and in the future, and it's time for this population to become a priority. The linkages between health and educational attainment are well documented. So the question is, where do you fit in? Perhaps you want to reduce asthma ER visits. Maybe working closely with schools could help students have more time and you to improve asthma management. STD rates are up in a managed care plan. In some instances, you may want to consult our teen pregnancy prevention programs as potential partners, and I'll talk about that work a bit later. And I have some other additional ideas as well about providing incentives to deliver clinical preventive services, including teen-friendly service providers and plan networks, engaging young people directly with regard to services and their policies in your program plans, providing families with information on transitioning into and out of adolescent care, engaging adolescent health specialists, and using risk screening tools with aggregated data to identify local health needs. And one example would be the Rapid Assessment for Adolescent Preventive Services, or RAPS. It always seems a bit surprising, but many pediatricians and family medicine specialists have limited training on what can be complex needs of adolescents. Some practices are very young child-oriented, and teens can feel out of place. Not all practices have clear routines for alerting parents and adolescents that as they become older and begin to mature, young patients will benefit from some time alone with the provider. And so I offer some thoughts here as well about having practice policies for transitioning adolescents in and out of care, for updating clinical preventive services at all visits, using screening tools and asking those uncomfortable questions, using brief interventions and other counseling techniques, and maintaining up-to-date referrals to teen-friendly services for mental health, substance use, and other conditions, and encouraging families to teach their teens how to use health care and health insurance. It's important also to ensure parents that talking to their teens does matter. They do hear you, even if you don't think they're listening. We also need to make sure that the work we're doing is done in a teen-friendly context. You might want to talk with teens and invite them to help with a clinic or an office makeover. And then finally, the importance of training all employees, including the person at the front desk, nursing staff, lab techs, and physicians, on ways to make teens feel welcome. So what can funders do in this area? I think that there are also ideas for foundations and for corporate giving. Foundations can include adolescent and young adults among funding priorities. They can provide support for innovations to improve adolescent health, and you have a terrific opportunity to braid your funding along with that of others. You can test new models for bringing care to teens where they study, work, and live. You can test new technologies in care delivery and communication. And most importantly, I think talking with teens and asking them their health priorities, I think you'll be surprised. In terms of corporate giving, asking adolescents and young adults what would help them maintain healthy habits, supporting youth projects that focus on improving community health. Perhaps you want to host a competition for healthy innovations for high school or college-age youth, or invite a school nurse to share their views on how to improve health for young people with chronic conditions. I hope some of these ideas have sparked thinking in your own areas. So having talked broadly about adolescent health, I'd like to talk for a few minutes about teen pregnancy prevention and teen parenting. The fact that teens are delaying sex and using contraception more often means the United States has reached its lowest teen pregnancy and teen birth rates in years. Still, 1 in 8 adolescent females will become pregnant before turning age 20, and the latest estimates reveal that more than 614,000 teen girls in the United States become pregnant each year. The U.S. teen pregnancy and birth rates are higher than many developed countries, including Canada and the United Kingdom. And in 2013, just over 273,000 babies were born to teen girls between the ages of 15 and 19 in the United States. We know that teen parents face multiple risks for poor life outcomes. Often they fail to finish high school and are more likely to be poor as adults. And the children born to adolescents face particular challenges as well. They're more likely to have poor educational, behavioral, and health outcomes as compared to children born to older parents. Teen childbearing also costs the United States taxpayers billions of dollars due to lost tax revenue, increased public assistance payments, and greater expenditures for public health care, foster care, and other services. You'll be hearing more about these consequences and the need to invest in teen pregnancy prevention from other speakers in today's webinar. At the Office of Adolescent Health, we're proud to support a national evidence-based program that funds diverse organizations working to prevent teen pregnancy across the United States. We invest in the implementation of evidence-based programs and provide funding to develop and evaluate new and innovative approaches to teen pregnancy prevention. This past July, we just awarded 81 new grants, and this is our second cohort of teen pregnancy prevention grants. These grantees are expected to serve almost 300,000 youth each year and more than 1.2 million youth over the course of the 5-year project. These grantees are receiving fundings to support replication of evidence-based programs, to increase the capacity of organizations to implement evidence-based programs, especially for vulnerable youth, including homeless youth, parenting youth, and those in juvenile detention and foster care. There will be supporting and fostering early innovations to fill gaps in the knowledge about what works to prevent teen pregnancy, and there will also be rigorously evaluating new innovative approaches to teen pregnancy prevention. On our website, you can learn more about our new grantees, including success stories and videos from some of the grantees from our previous cohort. The teen pregnancy prevention grantees in the current cohort just funded this summer are expected to establish and maintain linkages and referrals to a network of organizations that can provide high-quality, youth-friendly health care services. They're specifically required to identify and recruit organizations that provide a wide range of health care services for youth. They're expected to assess the identified organizations and providers to ensure that their services are indeed youth-friendly and accessible. They're expected to develop protocols and procedures for making those referrals, and also expected to develop and disseminate a provider referral guide. And finally, they're expected to identify and train key staff in their own projects on referral protocols and procedures. We're assisting grantees in having systematic processes to identify high-quality, youth-friendly providers to help ensure the services received will be in the best interest of the adolescent and to minimize barriers to receiving services. At the Office of Adolescent Health, we feel that a multi-pronged approach is the most effective way to address the challenges of teen pregnancy prevention. This approach can be seen on the 3 legs of this stool, all of which are essential. First, as described, evidence-based teen pregnancy prevention programs are a critical component. Second, connecting adolescents to health care, including family planning services, and making sure that they have both access to services and insurance coverage to pay for them. And finally, communicating effectively to and with young people about how to prevent teen pregnancy and how and where to obtain the services they need. And much of this is the use of new technology and social media messaging with young people. So in closing, I'd like to thank you for the opportunity to participate in today's webinar. I hope you'll visit our website and learn more about TAG and our grant programs and sign up to receive email updates. On the website, you'll find many useful resources, including current data about America's teens, the Teen Pregnancy Prevention Grantee success stories and videos, the TAG playbook, and the associated social media toolkit, as well as an adolescent health library. We hope you'll contact us at the email address listed here. You can also follow us on Twitter, and hope you'll use the hashtag Teen42Mil to spread the word about TAG. and how we're supporting America's 42 million adolescents. And finally, you can also see us on the OAH YouTube channel for videos about our teen pregnancy prevention program and TAG. I'm eager to hear the upcoming speakers and to answer your questions later during the webinar, and I'm very pleased to have been able to join you. So I'm going to turn it back over to you. Thank you so much.